Welcome back. Let's review the components of the cervical spine now. This first video is about the vertebra, and it will be followed by a second video on the joints of this section of the spine. The cervical spine is designed for mobility, so the head has wide ranges of motion. In a natural environment like a jungle, a human is a predator, but is also a prey. So vision is very important to survive, and neck muscles must be highly innervated for accurate movements that must be in time integrated in the brain with the vision and balance organs. Remember that the first curvature is formed by the occiput, the atlas, and the axis. These all together, they control the position of the head, so the vision plane stays always parallel to the horizon. For this control, independent movements between the first and the second curvature must exist. Let's see first how a typical cervical vertebra, those are from C3 to C6, look like. These have a body, a spinous processes that can be bifid, a vertebral arch surrounding the vertebral foramen, superior and inferior articulating facets, and transverse processes with transverse foramina for the passage of the vertebral arteries. These arteries, they come from the subclavian artery, and in turn the subclavian arteries, they come directly or almost directly from the heart. And also in these transverse processes, we have anterior and posterior tubercles. The body shape of these vertebrae change from rectangular at the top to increasingly round as they approach the thoracic vertebrae. As you see in the lower image, in an anterior view, the superior margin of the body is excavated and the inferior margin protrudes anteriorly. This is a unique feature of cervical vertebrae and is due to the uncinate processes pointing here in the image by the arrows. In the yellow box, you have the normal orientation of the superior and inferior articular facets of the zygapophyseal joints in this cervical vertebra. Here you have a real picture of C5 with its main characteristics. The C5 represents a typical cervical vertebra. All these images, the ones of the real vertebrae or real bones we will use throughout the course, just for your information, they come from this book you have here, Human Osteology and Skeletal Radiology, which I like a lot, and which is also listed in the module descriptor bibliography. Okay, so here you have again the distinctive characteristics of a cervical vertebra with further clarification. Know them well and take note of some of the details like how the main arteries of the neck, these are the common carotid arteries, run just in front of the anterior tubercles of the transverse processes of C5. Why is this important? Because a sustained pressure here will interrupt the brain blood supply, and well, you may kill a person. The first cervical vertebra is called the atlas, as you know, and articulates with the occipital condyles at the base of the skull. It doesn't have a body. Instead, it is a bony arch with two big lateral masses. It also lacks a spinous process, so no way to palpate it. You know that from the seminus. Since there is no body, there is either an articular disc between C1 and C2. As seen in the colored image, C2 has a dens that articulates with the arch of C1 inside the vertebral canal. Then C1 articulates with the occipital bone above. The lateral masses have the superior articular facets for the occiput and the inferior ones for the axis. Medially to those lateral masses, there is a tubercle. You can see it in the image on top of the text, inside the vertebral foramen. This tubercle is for the transverse ligament to attach and jump from one side to the other, from left to right or right to left. This ligament is to hold the dens of the axis against the atlas inside that vertebral canal. Okay, so here you have the blue arrow that is pointing to the vertebral artery ascending and passing through the transverse foramina in the transverse processes. This artery has to enter the cranial cavity because it's an artery for the brain. So first needs to get in the vertebral canal, passing between the atlas and the occiput thanks to a groove on the superior surface of the atlas. Here you have it pointed with a red arrow. The first spinal nerve also uses this groove to exit the vertebral canal. The transverse process of the atlas is longer than the ones of the other cervical vertebra and is used as a lever to rotate the head because there are muscles inserting at the tip of those transverse processes. All this is very important for chiropractors when adjusting the atlas. And you know that that's a quite common procedure in chiropractic. So here you can see how the vertebral artery travels and suddenly changes direction to access the vertebral canal. See, in the first image, first is very lateral, and as it goes through the transverse foramen of the atlas, it makes a 90-degree turn. Okay, so here the artery can be stretched when adjusting. Again, here you have real pictures of the atlas with all the details. And let's go for the axis C2. This one has a particular body with a dens that is also called odontoid process protruding upwards to articulate with the atlas. At the tip of the dens, the apical ligament attached, we will see that later, and on either side the alar ligaments attach. These ligaments travel upwards to attach to the occipital bone, so the axis is attached to the occipital bone as well. We will see them, as I told you, in the next video. The base of the dens, as you see here, is a bit more narrow than the body, so the transverse ligament we were talking before can surround it and apply it against the arch of the atlas. For this, the anterior surface of the dens has an articular facet that will apply against the inside of the arch of the atlas. It also has two lateral flat superior articular facets for the atlas. These are flat, so the atlas can pivot laterally, and so the head. Inferiorly, the atlas has an inferior articular facets for the next vertebra, which is C3. And here you have the real picture of the axis with its characteristics. All right, so here you don't see much differences because here in this anterior view is where the dents is so evident. The dents is about 1.5 centimeters high, so quite big. Here you can see the atlantoaxial joint and some other characteristics of the cervical spine as a wall. Okay, let's move to C7, which is the other special vertebra of the cervical spine. This one is called prominence because it is very easy to palpate, even to see at naked eye, when you bend your head forward due to its very long spinous process, which is more similar to a thoracic vertebra than a cervical vertebra because it's a transition vertebra. In fact, this is a vertebra that looks very much as a thoracic vertebra. An important detail is that its transverse processes have a transverse foramina, but the vertebral artery doesn't travel through that hole. Okay, so the first vertebra the vertebral artery goes through is C6. Okay, but we will study the path of the vertebral artery in the coming lectures. We will mention that again. And we will see how this vertebra joins the opposite vertebra and form artery, joins the other artery and forms the basilar artery that together with the carotid arteries take care of the irrigation of most of the brain. Okay, so it's a very, very important artery for chiropractors. And here you have a real C7 and its characteristics. Next, we will take a look to the very complex craniovertebral joints with all the ligaments involved. Okay, so that's all for this video. I see you in the next one.